One might think that muscle development takes place after hitting the gym a few times a week, but in reality, it starts much earlier. Our muscle development begins as an embryo, where the muscular system is broken into segments filled with nerves. The upper and lower back muscles develop first, out of necessity for covering and moving the limbs, which develop later. As early as 13 to 16 weeks after conception, nerves will begin to develop in the muscle. Around this time, an expecting mother will feel her baby's movements, called quickenings. Because the nervous system must develop before a baby's muscles can be controlled, we can trace nervous system efficiency by observing development milestones. A baby's muscular development begins from head to toe. A baby can raise their head and crawl before being able to stand and walk, and wave goodbye before they can pick things up. Muscles are in their most effective state as an adult, but if they are not stimulated often through exercise, one's strength can decrease significantly. As we age, muscle connective tissue increases, while regular muscle tissue decreases, causing muscles to become stringy and sinewy. As muscle tissue decreases, body weight does as well, because of the significant decrease of skeletal muscle. By age 80, muscle strength typically decreases by 50% because of the diminished tissue. However, older people can restore their strength by using hand and leg weights. Most elders are affected by muscle weakness, but some experience it early in adulthood due to the rare disease called myasthenia gravis. The root word astheń means weakness, and gravi means heavy. Those who suffer from this disease often have droopy eyelids, difficulty swallowing and talking, muscle weakness, and fatigue. The disease causes a shortage of acetylcholine receptors at neuromuscular junctions, and because our blood contains antibodies to acetylcholine, it is classified as an autoimmune disease. The receptors diminish more and more as the disease evolves, and often leads to death due to respiratory muscle failure. Muscles are vital to one's overall health from fetal development until the end of a person's life. To utilize muscles to their full capacity, it is important for one to stay active from childhood to adulthood so they can remain functional as your body begins its natural decline.